So hello everyone, how is everybody doing? This is John J. I'm back. I hope you all are doing fine, staying safe, no matter where you are across the globe. So anyway, today we'll be discussing fairly sensitive disease. I'm sure one way or the other, we've all been affected by it, either directly or indirectly, whether it be yourself personally or a family member or a friend. But one way or the other, we've all been affected by this disease. This is a disease that once you are told that you have it, or you hear that a family member or friend is struggling with it or is living with it, it's almost like a death sentence, because there is one that in most cases there is no cure for it. So you pretty much just buying time. So and this disease is cancer. Okay, I know cancer has become very common among our community as African or African Americans or even around other population. We hear or know of a lot of people that either have breast cancer, living with breast cancer, lung cancer, and so forth. So today I'm gonna be discussing, I'm gonna be sharing with you some screening guidelines for early detection of cancer as recommended by the American Cancer Society. So not all, we all know there's no cure for cancer, but there are some steps that you can take individually to either eliminate or decrease your risks for getting cancer. Okay, so I'm just going to be sharing briefly some of these screening guidelines that the American Cancer Society recommends that you do. And if these steps are taken earlier, we know early detection is always the best. So if something is identified earlier and you take the necessary step to either remove it, or if you are doing something that is increasing your risk factor for getting it, it will either eliminate your chances for the disease developing completely, or it will decrease your chances of getting it drastically. All right. So the first screening test I'm going to be discussing is for breast cancer. So for breast cancer screening, the screening that is recommended is called a mammogram. So if you are a woman watching me right now, and you are between the age of 45 to 54 years old, it is recommended that you discuss with your doctor getting a mammogram yearly or annually. So once a year, discuss with your doctor if you should be getting this test. The American Cancer Society recommend that if you are between the age of 45 to 54 years old, you have this mammogram done yearly. Okay, I know a lot of times we are scared. We scared of what the findings may be. I'm, sitting here personally, I haven't reached 45 years old yet, but I have started getting annual mammograms. Okay, so if you're a woman, I will encourage you to discuss getting this test done annually with your doctor. If you are between the ages of 40 to 44 years old, you can choose to have this test. It is not recommended at this age, but it is your choice. So you can discuss having it with discuss with your doctor if you should be getting it. I started getting mine earlier. Okay. And then if you are 55 years old and older, it is recommended that you have this mammogram done every 2 years by the American Cancer Society. So what a mammogram is actually almost like an x-ray. If you've ever had an x-ray before, that's what it is. There's no needle involved. There's no, well, maybe there is some pain, but there's no needle involved, and the pain is tolerable. It's not an extreme pain that will cause you any type of trauma. Okay, it's pretty much an x-ray of your breast just to detect if there is any abnormal cells or tissue in your breast that you yourself cannot see. And the thing with breast cancer, another way you can screen yourself is by doing, as a woman, to do self-breast exam. Because with breast cancer, by the time you detect that lung or that hard area in your breast, it's already far gone. So it's important. And then usually those lumps are so deep within your tissue that sometimes even doing your self breast exam, you may not even detect that is there. But these mammograms will help. It goes deep within, and the doctors can see if there's anything abnormal in there. All right. So the next cancer screening is for cervical cancer. Okay. For cervical cancer, the screening test that is recommended is called the HPV test, which is abbreviation for the human papilloma virus test. This is done by your gynecologist. Okay. So the American Cancer Society is recommending that if you are a woman between the age of 25 to 65 years old, discuss with your doctor, your gynecologist, or your primary doctor, who will then refer you to the right specialist to conduct this test for you. Okay. And then also, I know nowadays it's sad because for those of us, for our brothers and sisters that are still in Africa, most of these tests are not readily available. But we hope and pray that some days, things will improve in the healthcare systems within our African countries to make these tests available for our people so we can prevent some of these diseases and help save lives. All right. But in America, there are vaccinations that can be given to teenagers, whether it be male or female, to prevent this human papilloma virus, because it is this virus that can cause cervical cancer. Okay. And then the next screening I'm going to be talking about is the screening for colon. It's for colon and rectal cancer and polyps. Okay, it's colon and rectal cancer or polyps. All right. So the screening test for this one is called colonoscopy. Okay. So colonoscopy is pretty much a visual exam where it's done by your gastroenterologist, which is the doctor that specializes in dealing with conditions that affects your stomach or your abdomen. So this test, the doctor is done using a camera or a scope, and it goes through your rectum, and it looks all throughout your colon to see if there's any growth that's there that's abnormal. And these growths are usually referred to as polyps, okay? When these polyps are detected early, it can be removed, and it can either eliminate or drastically decrease your risk for getting colon or rectal cancer. So colonoscopy is recommended for everyone if you are 45 years of age and over. If you are in good health, the American Cancer Society is recommending that you do a colonoscopy regularly until you reach the age of 75, right? So it's called a colonoscopy. So start talking with your doctor if you are age 45 and over. If you have not done so yet, if you are fortunate to be in a country where these tests are readily available, please do talk to your healthcare provider to get set up for having a colonoscopy done annually between age 45 and over. It can save your life. Okay. And then the next one I'm going to be talking about is screening for prostate cancer. Okay. So the screening for prostate cancer is a simple blood test to check your prostate. And this test is the PSA blood test. So for men that are age 50, it is recommended that you start having this conversation with your primary doctor about getting this blood test done. If you are African American or from an African descent, and you have a direct family history of prostate cancer, meaning either your father or your brother had prostate cancer before they turn 65, it is recommended that you start discussing this screening test and start getting it done as early as age 45. So prostate cancer screening test is a simple blood test to check your PSA level, all right? Okay, and then the other screening I'm going to be talking about is lung cancer screening. All right. So for lung cancer, they pretty much do scans of your lung just to detect if there's any abnormalities in your lung. And then the key prevention for lung cancer, if you are a smoker, please work on stopping smoking, because smoking drastically increases your risk for developing lung cancer at some point in your life. I know it's a hard habit to break. Trust me, I'm not judging anybody. I'm just encouraging you to just start thinking about it, thinking about, what you can do or how you can help yourself. There's a lot of support out there if you need help in quitting smoking. But smoking drastically increases your risk for developing lung cancer. So if you are between 50 to 80 years old and in fairly good health, please just start having conversations with your doctor, seeing what support you can get out there to help stop smoking, to lower your risk for lung cancer. Okay. All right. And then lastly, it is endometrial cancer. All right. So this primarily is mostly detected in women that have reached menopause. So if you are a woman out there and you reach menopause, it's important that you tell your doctor immediately without any delay if you all of a sudden start having unexpected vaginal bleeding. Okay. Start talking with your doctor, let them know as soon as possible. And what they can do is do an endometrial biopsy. They'll go in there and take a little tissue and send it for testing to see if it's cancer or not. Okay. So this screening test can potentially save your life or lower your chances of getting endometrial cancer. So let us start taking, I'm just bringing this video out there not to be judgmental to anybody, but just so we can all start taking these little steps, being more aware of what's out there for us, increasing our own knowledge, being more informed, know what questions to ask when you go to your doctor office, depending on your age, depending on what you are experiencing, just to help all of us to take control of our own health and reduce our chances of getting cancer or any other diseases for that matter. Okay. So thank you all. This is, like I said, it's just screening guidelines that's recommended by the American Cancer Society for early detection of cancer. Thank you so much for your time, and I look forward to coming back again with more information. Like I said, feel free if you have any topic that you want me to address. Please do message me, post it in your comment, and I will be sure to bring it out there for you. Thank you so much. Bye, and have a blessed day.